So my name is Jason Ruff. I am the candidate for State Representative, District 183. We are sitting here in my diner, actually, Charlotte Bay's Main Street Diner in the heart of Slatington, Pennsylvania. And we are doing a coffee with the candidate here in the diner, and I will let Dan here introduce himself. We are talking about the opioid epidemic here in the district specifically, but obviously we're probably going to be touching on some stuff that's statewide and nationally as well. So I'll let you introduce yourself and your position.
Thanks, Jason. My name's Dan Carpenter. I'm with Center City Recovery. We are a treatment center. We help all kinds of people, and my goal is to get out in the community with people like Jason and many others and provide options for people that are out there struggling. I met him at an event that I wasn't even supposed to go to,
Yeah.
and it was just, we just started talking, and, here we sit. I always look at, in the long run, how is this epidemic going to end? What can we do? A lot of people talk about it. We need to find some solutions, and I'm just wondering on a bunch of questions, and maybe he'll have the answer, maybe he won't, but it's a shame what's going on out there. It's not going to get better until we all take some action, and I think it's going to take a lot of people to battle this thing. So obviously the big one, the first question, Narcan. Is it available in this area? What are your thoughts on Narcan? Do you think we're enabling people with the Narcan? To me personally, I think people are going to use regardless. If there's something there that, can save somebody's life, I'm all for it. I know many people that have been Narcaned and turned their lives around, and if it wasn't for that Narcan, they wouldn't be here.
Mm-hmm.
So what are your thoughts on the Narcan?
Well, so I certainly, I definitely want to get into the Narcan. I actually, just backtrack a little bit and give us a little history on how we ended up in the position that we're in right now, nationally or at a state level, because I was reading up on some things, and it seems like the opioid epidemic actually got started technically back in like the 1990s, when all of these prescription drug companies were telling everyone that these prescription drugs were not addictive. Correct. And now, fast forward to 2017, we're in this position where, a lot of people are addicted. And, what happened in between 1990 and 2017 that we now find ourselves in this position?
That's good. I mean, I just can talk from my experience and what I've seen in people I talk to. When we use that term drug addict, we don't think of someone taking pills that were prescribed from a doctor. Right. My doctor gave it to me, it'll be okay. And that's what they did. They said they weren't addictive, and they became addictive. It's an opiate. It hits all kinds of people.
Well, doctors overprescribe.
Absolutely.
Too, right? Like back then when they were telling people that it wasn't addictive,
correct.
They were like prescribing
Yeah,
left and right.
you could doctor shop back then. You can go to 6, 7 different doctors in the area. They started adding laws and things like you can't do that really anymore up here, right. Which is good, but it was just crushing people. So like people would get in a car accident and they would prescribe them, OxyContin with 6 months, and probably didn't need that.
Right.
And they caught a habit. There was other people that took them for the wrong reasons, obviously, but a lot of people got hooked on these things not knowing. Now, there are those people, like I said, people like myself, how I used to be, taking advantage of those things, but a huge number of people just followed doctor's orders, and they didn't know. They didn't even know what the term dope sick means. They just started getting sick, and when they couldn't get the pills, a lot of them, the next best thing in the world we live in is heroin.
Yeah. So that actually takes me back to the Narcan question. You asked me whether or not I support carrying the Narcan. I believe our EMS people in this area do carry the Narcan. I know that it's been used. I think what ends up being the biggest issue, I believe, for taxpayers is whether or not taxpayers should fund those organizations carrying this drug. But what I think we do need to look at, and what a lot of people don't understand, is that this epidemic is not simply just heroin.
Correct.
It could be somebody sitting at home who is taking prescription medication and they OD on prescription meds. So, these are fully functioning, great members of society, and they're addicted to something that they had really no control over. And, why would we say that they shouldn't be brought back to life? That would be, a little crazy to say that we shouldn't be helping a person in that particular situation. Not that we shouldn't be helping somebody who has OD'd on heroin. Everyone's situation is different.
Yes.
But I think, from an overall standpoint, do we want organizations to be carrying that Narcan? Obviously, we want to do a lot of research because every municipality might be different. But,
Yeah.
especially in areas like Slatington or areas like Northampton, where the epidemic is taking such a toll on the community at large, we have to weigh all of the pros and cons of carrying Narcan, among many other things.
For sure. I think everybody should have it. I mean, I have some in my car, regardless if, you have a family member that does or doesn't. What about, what would you do if right now somebody walking down the street just started ODing? Obviously call 911, but sometimes that's too late. When you're in a town, they might be able to get here quicker, but what happens when you're out in the middle of nowhere? There are certain places that are thinking about, like a 3-strike rule. So basically, so many times, your third time, they're going to stop responding. Now, that's not ethical. That'd be like somebody having a heart attack 2 times, and the third, you're not going to pick them up. So obviously, I'm for it too.
Well, the problem is, a lot of people in a community and a lot of taxpayers would say, there is a level of personal responsibility that goes into whether you OD or not. But I think we need to continually look at the larger scope of what it is to be an addict. To be an addict means you do have no self-control over that. So I think you would first need to really understand the disease of it all to be able to say whether or not we should help that person or not. There's a lot to look at here with this type of, it's a very complicated and complex situation for municipalities and communities to deal with.
Especially trying to explain, you brought it up, that disease concept.
Mm-hmm.
There's people that do agree with it, there's other people that think it's a choice, and that's their opinion, but bottom line is people are dying on a daily basis. I think it's, don't quote me, but about 179 a day in the United States are going to die today of an opiate overdose. That's a lot of people.
That's a lot, and
so,
they're coming out of our communities.
Correct.
Again, these are good, functioning members of society.
There are. So I mean, I just hope everybody sticks with it and stays on track with the Narcan. I don't know.
Do you see any other solutions other than organizations carrying Narcan? Because you referenced it earlier. If I saw somebody out there on the sidewalk ODing, I wouldn't necessarily know how to administer Narcan, even if I had it.
Correct.
So, at what point do we start to introduce other solutions aside from just carrying Narcan, which may or may not be available to somebody in that immediate, need?
I mean, I have some solutions. I have some thoughts, but let me back up real quick.
Sure.
It was tied with another question, and we talked about this before a little bit. Say somebody overdoses and the ambulance come, they Narcan them, they bring them back, they take them to the local hospital. It's not a long procedure. They can offer them help, and pretty much they're in and out.
Mm-hmm.
And my thing is, 90% of those people, they're going to go back out and use again, and
Right.
a lot of them are going to die. So I bring it back to the mental health
And
thing.
again, when you say use, you could be talking about heroin. You could also be
Anything
talking
else.
about those prescription pills.
Anything.
Right.
I mean, especially now, besides the prescription pills, all this stuff isn't even real stuff anymore.
Yeah,
it's all cut, and they're just dying. But my thing is, like with mental health, if somebody's suicidal or homicidal, anyone can make that phone call, and they can place them with what's called a 302.
Mhm.
So they would go to the hospital and they would be there for 72 hours, get evaluated, things
Against
like that.
their will.
Against their will.
Right.
Until
they're evaluated.
correct.
Right.
My idea would be, if you overdose, accidental or not, you should be evaluated for 72 hours. Maybe a moment of clarity might hit, maybe it wouldn't. But to turn somebody, let them walk right out the door, 2 hours after that happened, I don't think that's any kind of solution.
Right. Now, do you see that opening up the conversation about healthcare? Because obviously we probably don't currently commit that person right now because it wouldn't be covered by anything, would it?
To be honest, there's, if somebody doesn't have any kind of insurance,
Yeah.
they would look to the county. Like right now, if somebody wants treatment in Northampton County, just because they don't have insurance doesn't mean they're not going to get help. They would look at the county funding and
Okay.
see what's available. But I mean,
So there is county funding available for stuff like that?
correct. Yes, and also there's people with commercial insurance. There's all kinds of things, but everybody should have a chance to get help.
Right.
It's scary. It really is. So like I don't know. Is it hold that somebody gets their own will or not? Can you force someone? I know a lot of people that were forced into treatment some way or another, if it was from the mom, the judge, the parole officer, and they straightened their life out. Now, I know a lot of people that also were forced and they didn't take it serious, but who's to say when that person's going to get it? I was in and out of treatment 7 or 8 times until I got sober in 2011.
Yep.
So, like, if they say, if there's breath, there's hope. But I would wonder what you would have to do to look into a law like that if somebody would overdose.
Right.
How could we keep them?
Yeah, and I would definitely say that I'm suspecting there are starting to be those conversations in Harrisburg where they are looking at what legislation to enact to figure out how to address this. I know that there was some sort of task force created, which is a good first step. My only concern is that we're a little further along at this point than just creating a task force to do some studying.
Yeah.
I'm a little concerned that I think we're at this point where some action needs to be taken. I would ask you, to give a brief little history of some of these resource centers that are starting to pop up in different communities. I know that Northampton, I believe, Northampton Borough,
Yes.
just started a resource center on Main Street.
Street, yeah.
If not Main Street, it's like right around
it's
on the back of a
it's,
building or something like that. But-
Change on Main in Northampton. Right now they're open Monday through Friday.
And what exactly is the service that they're providing people there?
If you're struggling or you're not struggling, you just want to stop in for a cup of coffee. There's going to be meetings there. There's going to be people to help you out if you would like treatment. They can direct you in the right way. It's a safe place. It is funded by Northampton County. Like I said, we just started taking meetings in last week, so all kind of people are going to be around. They have computers there. You want to build your resume. You need help with anything. There's people to help you. There's also one in Bethlehem Recovery Center. There's one in Bangor, and there's one in Easton. Change on Third Street. I forget what the name of it is, but they're all funded by the county. And people work really hard to get these things going.
And who are they staffed by?
To be honest with you, Northampton.
I'm sure it's somebody with a license.
Yeah, everybody has
staff.
a license. I can't remember the name exactly who's affiliated, but everybody. There's a lot of people doing a lot of work in there. Some volunteers, some not.
Okay.
And it's just another. It's pretty much to say, look, the drugs and the alcohol, the activity, it's going to go on, but look, we're here. If you need help, we're here. And I think it's important. The stuff's not going to go away, but we got to step up and be available for people at any time.
So it sounds to me like Northampton County is leading this charge,
Yeah.
at least in the Lehigh Valley area.
Absolutely.
Is Lehigh County, have they done anything in the Allentown area or in anywhere else in Lehigh County?
To be honest with you, I don't know any recovery centers resource centers like that in Lehigh County, like I don't want to say a clubhouse kind of thing, but that it's just for, you can walk right in.
Right.
Now, of course, there's places in Lehigh County that can do assessments and things like that, but nothing like the things going on in Northampton County. And this is for, people. You don't, like I said, you don't have to be struggling to come up, get a cup of coffee, and maybe you can help someone. If you have an hour or something out of the day or whatever, and it's just another resource, and I think it's going to be big.
So it sounds to me, Dan, that we are starting to move in the right direction as far as certain counties at least taking action, and
Yes.
others will probably follow, like maybe I don't want to speak for Lehigh County, but it seems like maybe they might be looking to the success of these Northampton County resource centers before they take any action. But again, I think we're at that point where it can't hurt to open one. I mean,
Absolutely.
obviously Northampton opened one,
Yeah.
and it must have been successful enough
Correct.
that now they have, what, 5?
Four,
Four.
I think, yeah.
Okay.
4. And I think that'd be a good idea. I don't know what all goes behind the funding. I'm not a funding guy, but I'm sure they're looking at it because they're getting the same calls Northampton County's getting with, the drug and alcohol thing going on. And another thing which I think is huge. You said, what could we do? I believe it starts with our youth, and I'm talking like middle school. And I know a lot of parents don't want to hear that, but kids are starting to use earlier and earlier and earlier.
And I'm sure the data shows that, right?
Yeah. So, I think there should be presentations from outside people, probably quarterly, from middle schools to high schools, and
Well, the problem is if you don't deal with it when the data shows it's an issue, you're forced to deal with it when it's your kid later.
yeah.
So if you can prevent that, why
Correct.
wouldn't you?
Correct. And parents should be involved too. Like, there are a couple events around here. They had mock bedroom setups. Where kids hide drugs or alcohol. Like, parents should be like technology right here. They should be
Easy access.
They should know what's going on, and it's not snooping around or whatever. Like, this is life or death. Like, your kid takes one bad pill. It's not like it was 15 years ago. It's a lot different.
Well, it's almost, what I'm thinking is you would want to make the education and the resources as easily accessible as the drugs are.
Yes.
Or
Yes.
if not more.
Yes, but like I said, the parents and the people in the community, not only the addict or the alcoholic or whatever, but the community needs to come together, regardless if they have someone that's struggling or not. Like, we're all whole, and if people have to be paying attention. I guarantee you, if we'd walk up and down the street and knock on the doors, I would say maybe 25% would know how to administrate Narcan.
Okay.
And they have, different spots. If you read in the paper or look online, they have a free Narcan training. You can get certified on how to do it. That stuff's important.
Mhm.
If you have it and don't know how to use it, and something came down to it, God forbid, I hope you know how to use it.
Yeah.
But it's just, that's another thing for the community. When they have events, recovery events or whatever, it's not for people just in recovery. It's for the whole community.
Right. Well, it's like, there were those organizations that were getting started back when I was in high school. You had Mothers Against Drunk
Yeah.
Driving, you had SAD,
SAD.
you had DARE, and you mentioned DARE earlier.
Yeah.
You had all those programs that got started at a community-wide level. It may have been one mom that was impacted by drunk driving, but before you know it, the whole community was involved in that
Correct.
conversation, and it was exposed to us in high school.
Yeah.
There was no middle school when I was
Yeah.
back then, but if the data is showing that we should start having some sort of opioid program or organization, just like MAD or SAD or DARE, in the middle schools, then if
Or-
the data points to that,
Yeah.
we might want to offer that.
Or add to it, it's, and like recovery for myself, I know, is repetition. So, like, going in once a year to kids, that's not enough. When you're taking history class, you're taking history all year long, or the whole semester, or whatever it is.
Right.
And it's kind of, yes, you got to drive this stuff into them, like you're going to die. Now, there's other ways to word it, but for me, I'm kind of just straight to the point. Like, that's what happens.
Right.
This fentanyl that's in it, and we're not even going to just talk about heroin. It's in all the drugs. You know, ecstasy, cocaine. You know, stuff's laced in marijuana. You know, this K2 stuff that's out is people are dropping. Like it's a whole different scene now. So repetition's huge, and we have to have the parent and things should be open for the parents too.
Yeah.
Like if you have an event or you know an opening at a high school, that place should be packed. They should have to have 2 events for it.
Well, I certainly would advocate for community events like that.
You know, it's
community-wide,
important.
maybe even county-wide.
Correct. That'd be huge. But our youth is, I mean, I have a little girl. She's only 2 years old, but I think, you know, hopefully this can be fixed by the time she's there.
Yeah. That's up to us.
It is, but it's a shame. It really is, and I think you know people just keep trying to put things in place and realize it's really happening. You know, it's like I said, you know, it's always easy to say it's not my kid, but until it is your kid, then what?
Yeah.
You know, you have to have resources. You have to make a phone call, or where do you go? There's a lot of parents that have no idea where their kid's at on a Friday night, no clue. Think they're with Billy, you know. But
Well, I think we are starting to make some headway at the municipality level. I mean, we're certainly making the headway in Northampton at the county level. We're obviously making it in those communities where those resource centers are, and hopefully there are people from outside of those immediate areas that are coming in and using that resource center. So, you know, we could be having this conversation at a borough council level, you know, because it could look like a resource center here in Slatington, filling up one of these empty storefronts or something like that. You know, we could kill 2 birds with 1 stone.
yeah,
You know?
there are some empty ones.
Yep.
So the last thing I wanted to touch on, it's been happening a couple spots, and I know in Philadelphia they're talking about it, and I'm gonna leave my opinion out of it, but there's something called the safe injection sites. You know,
A
basically.
contentious issue.
Yeah, and I don't know. I mean, it's like.
Well, what do you say the pros and cons are? What are you hearing in your
I mean,
circles as to what the pros and cons are of
again,
that?
I'm going to leave my opinion out of it. You know, obviously it's safer. Obviously, you're around people, doctors, people are literally there. I would think the crime would be down. You know, there's resources there if you decide, you know, you would want to get help. On the flip side,
Are there resources inside that safe injection site that attempt to steer the person away from injecting before they inject, or do they allow them to inject as soon as they're walking in the door?
to be honest with you, every spot may be different. I just know that resources are there if you decide, okay, I had enough.
Right.
I just know for me, and I always bring it back to myself because I walked in my shoes. To me, that'd be like enabling. That's just my experience. Like, if I had nowhere to go, but I could go over there and do what I do, why would I stop?
Yeah.
But
The
there's
flip side is the addict in a person
Correct.
is going to cause that person to go and inject,
yeah.
whether there's a safe site or not.
And you know, they have needle exchange and things like that. You know, keep away hepatitis C and HIV. That's, you know, a good thing. But and God forbid something happens to somebody, they're not. You know, a lot of people die alone.
Right.
You know, they overdose and die alone. But it's gonna happen. You know, there's all kind of statistics out there. But
Are there nonprofits out there running these safe injection sites? Because I would almost bet that the biggest issue and hurdle for sites like that would be the question as to whether or not it should be taxpayer funded.
yeah, I'm not.
You know, should the county pay for that with
Yeah.
taxpayer money, or any municipality? You know, versus.
I'm not sure. The one in Philly's not up yet. I'm not even sure, and I don't even know any around here. But I know there's some out there, and supposedly, like the charters, the stats are improving. I mean, so I'm not sure. I mean, I shouldn't assume, but somebody's gonna be paying for that, and that would cause. I mean, let's rewind. We're talking about Narcan. A lot of people get upset with the Narcan. Can you imagine opening up a place?
Yeah.
I couldn't even see people even, that don't understand how it is.
Right.
You know what I mean?
Yeah, and honestly, like you, I'm not going to say one way or the other whether I would or wouldn't support something like that. I see it exists.
Yeah.
Those safe injection sites exist, and if that ends up being a part of the smart solution that our communities need, we need to look at that
Correct.
and explore that. So,
I mean, I guess it's worth a shot. It's nothing's forever.
Yeah.
Just because they open up doesn't mean it's, this is how it's always going to be, kind of thing. But
well, and just like the resource centers, once they're open and they start serving the community, you start collecting data and
Correct.
you start to able to analyze that data and look and see whether it is, contributing in a positive way to the community.
Absolutely. I think that's it. We talked about some funding. We talked about the schools, Narcan, injection sites. Just back to the community thing. This whole thing with the stigma, right?
Mm-hmm.
Like, it needs to be done with. The stigma got to stop. It doesn't matter who you are, what color you are, how much money you have. It's a shame that it had to happen like this and how many people had to die, but like, I don't even call it an epidemic. It's really a war zone. I mean, people, like your next door neighbor might be the nicest guy, quiet, goes to work every day, and he could have a huge pill problem, and it's not the homeless guy underneath the bridge anymore.
Right.
It's wherever you look. So, I mean, I encourage people to, just do your best and get educated, regardless. I mean, we all can get educated, and just try and give a helping hand. I mean, there are small communities, and the amount of activity going on is through the roof.
Mm-hmm.
It's through the roof. And awareness, awareness needs to be raised a lot. Schools, parks, whatever, what have you, churches, whatever you got to do to get people to come together as one, we'll be able to start doing this thing. But until we stop pointing a finger and he's a junkie or he's that or he's this, it's making it that much harder for that person's son that you just called a junkie to go out and get some help.
Oh, I know people here in Slatington, it's their mother. So, it's impacting everyone. It's not
Correct.
just that 13-year-old kid
Yeah.
who's trying heroin for the,
Yeah.
whatever. It's, this is a middle-aged mother.
Yeah, it happens. Like I said, it doesn't discriminate. And finally, I would like to say there's other ways to, you asked me earlier, like other ways to attack this, and some people need treatment, some people need to go to jail, but there's others that don't. There's others that can see doctors, they can get counseling.
Right.
Whatever it takes, I suggest to people, whatever it takes and it's safe, go for it.
Right.
Everybody recovers differently, everybody battles things differently, but like everything, just do your research on your doctors. Everybody has a newspaper, everybody hears the news. Some doctors don't play by the rules, and they all get caught. But do your research. Talk to people about it.
Yeah, part of the solution is holding those doctors accountable as well, and
Correct.
the pharmaceutical companies.
Yeah, and they are. And I know just yesterday, 4 got indicted like an hour from here. And it's disgusting, but it needs to be happening.
Right.
And that doesn't say don't trust your doctor. There's a ton of great doctors out there. Just do your research. Just like if you go to treatment, do your research, and just try and work together. I mean, really, it's rough out there. And I think whenever we can get through this, or not through it, but, we're going to be able to get some ground. It's going to take some time.
Right.
It's going to take some time, and unfortunately people are going to die.
Yeah.
But we got to try something different.
Yeah.
That's pretty
Absolutely.
much it.
Well, thank you so much.
Thanks.
This was certainly the beginning of my research, and I thank you very much for sharing all of the information that you've
Thanks for
got.
having me.
Yeah, no problem. Thank you.
Good luck.
Yeah, thank you.
Thanks.